Reproductive endocrinologist gave her lecture and she put this slide up and she was like, I'm really sorry I have to do this, but this is the slide of how your fertility declines with age. Any of you, if you think you might want to have children, I just encourage you to do it as soon as you possibly can, because all day long I see people who wish they'd started sooner. And I was like, we got to have a baby. They gave a lecture. It's time. There's the graph and it goes way down. I think I probably would have been more likely to do a fellowship if I had gone through the whole process with no kids. I would have been less tired. I wouldn't have needed the money. I wouldn't have felt so desirous to get a house with some bedrooms for all the people I kept making.
Welcome to Your Future in Sight, a podcast where we showcase stories featuring doctors and other healthcare professionals early in their careers.
We'll take a deep dive into their day-to-day lives, focusing on how they navigate the current landscape of medicine. Each story is personal, captivating, and uniquely crafted by their individual perspectives and experiences.
In each episode, we'll discuss their challenges and aspirations, and most importantly, their journey to give us insight into the future of medicine.
My name is Andres Parra.
And I'm Gio Campagna.
And we are your bro hosts, two friends turned ophthalmologists who enjoy learning from our peers. Let's get started.
In today's episode, we will be speaking with Claire Smith. Claire is an ophthalmologist working for Kaiser Permanente in Portland, Oregon. Claire took a so-called non-traditional path to medicine, completing her undergraduate studies at University of Michigan with a subsequent Master in Fine Arts at the University of Texas, initially working as a teacher and a writer. Claire eventually switched gears and pursued her interest in medicine, attending the University of Chicago for medical school before completing ophthalmology residency at UCLA. In addition to being an empathic physician and a fantastic surgeon, Claire is also a mother to 3 awesome kiddos she had at different stages of training and early career. All right, Claire, thank you so much for joining us today. It is an absolute pleasure to have you. We can't wait to have a conversation with you. We like to get things started pretty casual and just have you tell us a little bit about yourself. Clearly, you've taken a little different route to most of the guests that we have on in terms of talking about going directly to medicine. You've taken a little more circuitous route. So tell us a little bit about your background. Tell us about yourself.
Sure. So I was an English major originally. I wanted to get a master's in creative writing when I finished college. I worked for a couple years before I did that. And then I got a master's of fine arts in poetry at UT Austin. And at that point, I loved it. It was great. But I sort of felt like I wanted to have a job where I would be a bit more employable than a poet. My dad was a surgeon. He was a really happy surgeon. I thought I might like doing surgery. I decided to go to medical school without totally understanding all the ramifications of that decision. And then I did a 1-year post-bac program where I knocked out all the prereqs. I went to medical school at U Chicago and then went into ophthalmology where I met Andres and Gio, you guys at UCLA. And now I work at Kaiser in Portland, Oregon. I'm a comprehensive ophthalmologist, so I kind of see the gamut of eye disease and do a little bit of everything.
Yeah, I think there's definitely a lot of meat on the bone there that we can chat about, and we're excited to get into it. But first things first, I wanted to know, that is an interesting backdrop. You were a poet. What was it specifically that, kind of made you think, let's veer off into medicine, knowing that your dad had done it previously? And how difficult was it to make that decision? Was it pretty easy? There's a lot of life decisions that you have to make. It's a pretty drastic change. So what was that like for you?
I think like any big life decision, you just don't know what you're getting yourself into at all. And so it was easy to make because I think I thought, well, I know I'll be employable. I know I'll have to take on some debt, but hopefully I'll be able to pay it back. I don't think you can understand the nitty gritty of the day-to-day of medical school and residency, but admittedly being through that now, I'm glad I made sort of a foolhardy decision or what was maybe foolhardy at the time. I think I thought I was into creative writing. I was into the creative arts. And I thought surgery sounded like a way to have a job where I would still get to have a craft and I would still get to feel I don't know, not an artist, but feel like I did something sort of creative with my time. And I think that's been true. It's certainly a flow state unlike any other when you get in the OR. So I think I did have kind of innocent and incomplete ideas about what it would be like to become a doctor and be a doctor, but I do really like it. I'm glad that I've gone through with the path at this point for sure.
So did you go into medical school knowing that you wanted to be a surgeon, or were you relatively open-minded?
I think I always treated it like I I should act as if I'm going to do that. So, when you had to choose research projects, I looked into research projects that were kind of in the surgical fields. I talked to mentors who were surgeons, and I thought about other things. I thought about psychiatry. I thought about emergency medicine, but I loved surgery. I thought about general surgery, which that's when I admit I don't regret not choosing general surgery.
Yeah, I think we've all once considered general surgery, and then
you think about it. You think, how bad could it be, really?
Well, that's kind of just like medical school too. Yeah, the same like medical school. You didn't really know. It's a foolhardy decision. You don't know what you're getting yourself into. But they do say for general surgeons, like if you know that it's literally the absolute only thing you could be doing with your life, that's how you know you're going to be a general surgeon. If there's anything else, any other specialty that you're considering, do that one. That's what general surgeons told me. That's from the horse's mouth itself. I think they're all fantastic people. So, my next question for you is, again, this was kind of a non-traditional path. It seems like you're a pretty casual person to me. I don't think you ever go into like high anxiety, you don't have the personality to be a super anxious person when it comes to making these decisions. But when going through medical school itself, was it ever different to be a non-traditional, being a little bit older than some of your peers, or was it pretty seamless?
My medical school class had a lot of people who had taken between like 2 and 5 years off. And so I didn't feel like I was all alone out there. I was on the older end, and I had a kid in medical school, and that was not common. I think the only other people who had children in medical school were folks who had gone to do a PhD and then come back. So I don't know. I didn't feel like I was too outside the norm.
Tell us a little bit more about that, though. I mean, it's like you became a mom in medical school. Did you always know that you wanted to be a mom? How did family planning come about during medical school? I mean, that's you're busy enough. I remember during those days of medical school, I'm trying to survive, like getting up at like 4 a.m. so I can go pre-round on these surgical patients that I would just be told that I did everything wrong on. So I'm wondering how you balance that.
It's great training for parenthood, though.
That's fair.
Great training for parenthood. You're up in the middle of the night. Somebody's yelling at you. Like, you're doing it. Surgical, residency, and parenthood.
You're cleaning poop.
A lot of, yes, exactly. A lot of similar. We got all your supplies. Yeah. We had a lecture, I think it was second year. I remember the reproductive endocrinologist gave her lecture, and at the end of it, she like put the slide up, and she was like, "I'm really sorry I have to do this, but like this is the slide of like how your fertility declines with age, and like here are the big like points where it starts declining, and like any of you, if you think you might want to have children, I just encourage you to do it as soon as you possibly can, because all day long I see people who wish they'd started sooner." And I remember going home and talking to I think he was not my husband at that point. And I was like, we got to have a baby. Like they gave a lecture. It's time. I got to do it. There's the graph and it goes way down. And so we got to do this. And,
so sexy.
Bless him. He's totally unflappable. He was like, oh, okay. Yeah, we can talk about that, I guess.
Yeah, I actually don't know if I knew anyone in my medical school class that had a kid. Do you remember any?
I think I had a couple. I knew a couple that had one before and had another one during, but I don't know if I knew any women that had females. I might be wrong. There was a bigger class, but that's clearly something to think about. And I mean, you have 3 kiddos. So just to track back, you've had one in medical school. I know you had one during residency, and we'll touch on that a little bit. And then you had one as an attending. I don't think it's like a linear thing. Having one kiddo myself, I can't even imagine the second one. I don't think it's just like, oh, you did one, so number 2 is going to be 2, and 2, 3 is 3. I think they all bring their own little, possibly exponential differences and things of how you have to restructure your life potentially. But what was it like having them at different stages for you? Like, what was it like having in medical school versus having the second in residency versus having another as an attending?
I think the one I had in medical school, I was just so naive, which was great because you can't possibly know what you're getting yourself into. So you just jump in, and like, that's parenthood, and that's residency, and that's anything challenging that like people can tell you about, but you have to experience for yourself. Having a kid during residency was awesome. I really wanted to have a kid during residency. It like took longer than I wanted it to take. So by the time he showed up, I was like over the moon thrilled. And I had him right at the end, which was great because I felt like by the time he was born, I was like, okay, I can do anything for 5 weeks. Let's roll on through, bang out a few more cataracts. Like, this is it. And then having the third as an attending, felt like icing on the cake. You just are, at that point, you have all the perks and all the benefits of attending Hood. And so it was awesome being able to like take a reasonable maternity leave and come back and have like breaks for pumping and have all, like many of my colleagues also have kids and having their kind of like understanding and support. I had support with every single kid, but having people supporting me who really had been through it themselves was very cool too.
One question I have, kind of dialing back to medical school, when you were starting to consider the, maybe the subspecialties that interested you the most, did having a child and maybe knowing that you wanted to have more children have any influence at all on your desire to pursue or not pursue certain subspecialties? I mean, ophthalmology is sort of seen as this excellent specialty that balances work and life really well. And I could easily see someone looking to ophthalmology, knowing that they can probably have, a couple children in training and do it and do everything well. So did that play at all in your decision making or not really?
I think it probably did. I was pregnant when I was deciding, but I hadn't had a kid yet. And I remember the chair of ophthalmology, like she was female. She had a couple kids that she had during training. And I remember when I told her I was pregnant and she was like, awesome, great. Okay, that's great. No problem. But when you go to interviews, we're going to get you like a really big coat and like a huge scarf. It's going to be like, but don't tell anybody, but it's great. Totally support you, but don't tell anyone. And I don't know. I think like I have some thoughts about that. Not all of them are like positive, but I also think that it was great feeling like I was talking to somebody who'd been through it before.
Yeah.
And there are a lot of women in ophthalmology compared to other subspecialties. So I think seeing women and seeing parents and seeing mothers in ophthalmology like made it seem more doable. I also remember emergency medicine. I was thinking about emergency medicine at some point, and I was like in my first trimester of pregnancy doing night shifts. And I was just like, nope, I'm not going to do this. This is terrible. And I think I would have figured that out whether or not I was having a kid. I also remember we had one of our career counselors who gave a talk at some point, and he said, listen, if you're deciding between multiple things, I'm just going to tell you that most people, as they age in their lives, they like to have more time and they like to have more money. And, you might think that you're different. You might think you're special and you don't like time or money, but you probably will someday. And, I think he was also coming at that from the perspective of parenthood, that like, kids are expensive and you want to be there for them. You want to be able to spend time with them. And so specialties that allow you to have a more reasonable schedule, it's nice to think about those. I'm sure it impacted my decision a little bit.
I mean, this kind of goes into too what you were saying. It's like making the foolhardy decision of going to medical school itself. I mean, you have to have such a long-term, it's easy to get myopic when you're in medical school or when you're going through residency about what you want your life to look like. But there's so many changes that you're going to go through in your life. And, if having a family is one of them, it's hard to fathom. It's like, as physicians, we want to do what we're passionate about and we want to take great care of people. But sometimes maybe when you're the neurosurgeon, if it's not 100% your passion and you're like, this is an ends to maybe making a little bit more money, or vice versa, you do something that's a little bit more low key, but you're not going to get, as a pediatrician, who are really important, but are horribly, reimbursed by insurance. And it's just a terrible system, the way that pediatricians are reimbursed. It's hard to have those thoughts of like, what am I going to think 20 years down the line? Is this going to be something that I'm going to be happy doing, that I have enough time, that I'm passionate about, and that provides for my family? And so all really important points that, we have to really sit down and think about when we're in medical school and think about these things super long term, which is very, very hard to do. But I want to cycle back a little bit to, you were talking about going through interviews and going through all of that while pregnant. And I'm sure that's a very taboo subject, but I kind of want to know your experience of what going through that was like. What was it like? Did you get inappropriate questions during interviews? Because, there's questions that you're able to ask and some that you're not able to ask. And I can only imagine some old traditional faculty that maybe didn't get the memo and just asking a question anyway. So what was that like for you? Did you ever feel uncomfortable? And did you know what to look for as someone who was pregnant and knowing that you were going to have a child during residency and all that good stuff?
Yeah, I had no idea what to look for. I think it's hard to ask those questions whether or not you have kids, because you can't show up to residency interviews like, so is it easy? Like, what are the hours? Like, call's pretty easy, right? Everything's chill. Like, nobody, as far as I can tell, nobody knew I was pregnant at any interviews. It's just my first kid. I didn't show for a long time. I think I was like almost 7 months pregnant at my last interview.
Wow.
And like I had a big jacket. And so I didn't get any comments from any attendings. I had one comment from a fellow at the last interview, and I was asking him about rents or like what the rents were like in Palo Alto. And he was like, "Oh, do you have a family?" And I said, or I think he said, "Do you have any kids?" And I said, "No." And he said, "Oh, would you like to?" And I said, "Yeah." And he said, "Soon." It's like, yeah, pretty, maybe. Yeah, we'll see.
The single bead of sweat dropping down your forehead.
Right. Yeah, exactly. Like I just had like so much Thai food. I was like really sucking in, I'm sure. But I didn't encounter any inappropriate questions. I did at my Kaiser interview. I think one of the folks who since has left the practice, he accidentally asked me something, one of the questions that's taboo, like, "Oh, are you planning to have more children?" or something. And immediately, like his face went white as a sheet. And I started laughing. I was like, "Definitely, but look at you. You know, you weren't supposed to say that. It's okay. I don't mind, But I've definitely been in that situation as an interviewer too, where you're like trying to learn about people's lives and be friendly. And then you have to remind yourself you're not allowed to like ask what their spouse does. Or I don't even know what those questions are. I have to look over a sheet, honestly.
Something that I think prospective applicants can look to if you're trying to gauge whether or not a program, may be at least suitable for having a child or two as a resident, is looking to see how many of the current residents happen to have children already. And you can kind of do that, I think, in a subtle way. But I know, at UCLA in the ophthalmology program where we trained, I think there was at least one person in every class that had a child, at least one, maybe multiple. And that's a good sign, I think, for, a prospective applicant. You don't have to ask anything of the faculty. You can just kind of figure out, yourself on the interview day if there's any of the current trainees that have kids. And that tells you a lot, I think, about what the program might be like.
Although it's still probably, I heard that might be hard to navigate. Someone has to volunteer that information. That's because true. If you're to ask, even if you're going to ask like a current resident, like, "Oh, does anyone have kids?" That might ring back some sort of alarm bells and be like, "Oh, well, they're going to bring it up to the program director that this person asked about kids." But I want to bring up the point, Claire, you're talking about like, "Oh, is this like chill call?" And by all means, we went to a program that's very rigorous, difficult call, lots of hard work. And Claire was not somebody who ever shirked responsibility. I remember, and this is such a distinct memory I have. I believe, I don't know if all of you at Harvard, we were at county location, and she must have been like 34, 35 weeks, had big old pregnant belly. And she's just talking about like, "Yeah, it's getting real hard to work around the slit lamp, and doing surgery is like getting a little bit harder on my back." And I'm like, I am trying to figure out the mechanics of surgery for my non-pregnant body. And she is somehow operating with a giant belly. And it just goes to show, I appreciate it. I never felt like, "Oh man, Claire's taking this time off. All the rest of us have to cover her call." You really went out of your way to make sure that you had taken care of call on the front end, and then whatever you had to cover on the back end to make sure you'd done your share, it was done. I think none of us ever felt like, that you were shirking any kind of responsibility. And it's tough because you have to balance being a mom. Sometimes some people get more sick than others during pregnancy, and you can't help it. But I think a lot goes to show that your effort matters a lot. And just to know that I knew that you were always putting your best foot forward to try to make sure that you were going to do your work. And you have to train during like a very busy surgical year. Like that's, yes, an appropriate year to have a child because you have more time and you're not like a first year surgical residence. There's never a good time. But you have to have a certain amount of volume. So my question to you is, what was it like knowing that like you had to fill a certain amount of quota? This is during COVID-ish days when we didn't have as much surgery going on. So how did you think about the repercussions of, having a child and whether you'd be able to get enough volume to feel comfortable doing surgery when you finish residency?
Yeah, I mean, I've thought about this some. I think there are so many ways that people do it, and there's no perfect way. Like some folks, when they have kids in residency, they extend their residency, they make it longer. Ophthalmology is so short. I don't know. I don't know that I would want to do that. You'd be extending your residency by like a sixth or something. I think it helped a lot for me going to a busy program. And that was something that I thought about in terms of looking at UCLA. It was like, you go there, you're going to get good experience. even if something like COVID hits, you're still going to be really busy. Even if you have a baby, you still have a ton of cases that you're gonna have great surgical experience. And so I think, I don't know, I was fortunate in that way. And honestly, like I took off the period of time that's the elective. A lot of people aren't operating during that time anyway. So I think, as far as I could tell, I probably missed out on like 10 or 15 cases from being out, which kind of a drop in the bucket once you get into private practice and you're like, that's a week,
But in your first 200 cases like that's a significant drop. But I will say, my own perspective is you are among the top, if not the top surgeon in our class. So at the time of graduating from residency. So clearly nothing held you back.
Yeah, I had some great like patients when I was pregnant more recently, where I was like eight months pregnant, 9 months and still operating. And they'd be like, can you do this? And I was like, this is how I learned surgery. Like, absolutely. This is my natural state as a surgeon. Like, I'm meant to do this. This is all the ergonomics are correct now. Yeah.
Well, I do think, to be fair, I do think every pregnant resident's experience with surgery is very different, and it depends on what residency you do, right? Ophthalmology, not to say that it is by any means easier on the body, but we certainly do get to sit down for surgery, and cataract surgery doesn't
it's huge.
take as long as, standing for a 4-hour, open laparoscope or whatever, some sort of big surgery that I don't know. I imagine it's very different, but even still, it's certainly not easy ergonomically when you're pregnant to work around a slit lamp, to work around the patient's bed, and I think it's very, very difficult. So good for you for toughing it out. I find that even in my most able-bodied day, I'm still complaining about how difficult it is.
My back's just thinking about surgery that I did this past week. So I'm with you. I'm hurting.
I do feel like you learn how small all the exam rooms are. Like all of a sudden you're like, oh, I have to like move this thing out of the way. And then
it's true. It's like working with a herniated disc almost. You kind of like move within your limits, right? And you don't necessarily overdo it. But I think that's really a testament to how mentally and physically tough you were as a resident. And I every time I complain about my back or my neck or my ankles on a day of surgery, it's nothing like what you must have been through. So I think that's really, really true.
Yeah, I was lucky too, but I appreciate it. Yeah.
Yeah, no, you're definitely really strong in getting all those things done. My other question too. You left and you said it wasn't that long of a period of time. And you're right. We had an elective period during which, we weren't operating as much. And so not getting to do surgery for those 15 cases maybe didn't matter. But that time that you were away from the OR, do you feel like that, when I'm gone for a vacation for a week and I come back and I'm like, all right, I got to do my stretches. I got to be prepared. Like it's like getting back into the OR is always, almost superstitious process. And so what was it like knowing that your hands had all this rust and that you had to kind of work that off? I experienced some of that going into my first year of training of practice when I wasn't as busy to start out. So I wasn't doing as much surgery, and I'm sure Gio can relate. But what was it like not doing any surgery at all during the times that you've been pregnant in residency and as an attending?
Yeah, I think in residency, it wasn't as big of a deal because it wasn't as long of a time. Like it was 6 weeks or so. And we had some blocks where for 6 weeks, you just wouldn't do a surgery. And so I think I was more used to that and accustomed to that. But I remember going back and going to Martin Luther King with Bull and it's like banging out 7 cataracts and coming out into the sunshine. And you just feel like a god. Like you're like, I still got it. Like, yes, it didn't go anywhere. And coming back from my leave this time was more intimidating because it had been like 5 months or something. I mean, it was a long, maybe almost 6. And I like the day or two before I looked at my schedule, and my surgical scheduler had scheduled me like a traumatic cataract that, in like a former retired physician that ended up having all this like zonular loss. And that was like the first case I came back and did. And I cursed her name, but at some point I was just like, I got to do it. Like you can do it now or you can do it later. You got to do it. And I think it really only takes like a week, just 1 week, and then you're back in it. And that's probably true of like long vacations too. You come back and you're like, okay, it's been a while. This feels different, but
a lot of it's psychological.
Yeah.
Yeah.
I mean, we've all been through this at some point, maybe whether it be from the transition from residency to attendingship or fellowship to attendingship. Often there's a several month gap in between your last case as a trainee and your first case as an attending. For me, it was about 3.5 months before I got back in the OR, and the anxiety was mounting. It was high. So I can definitely empathize with that. One thing, I do want to circle back to what it was like having your second child in residency, and I want to know if it affected your career decisions or if it had any influence on what you decided to do with training. Did it influence your desire to do a fellowship? What kind of practice maybe you wanted to join? Did it matter at all?
Yeah, I think it might have. I think I probably would have been more likely to do a fellowship if I had gone through the whole process with no kids. Just because, I don't know, I would have been less tired. I wouldn't have needed the money. I wouldn't, I wouldn't have felt like so desirous to like get a house with some bedrooms for all the people I kept making. And I think I liked looking for jobs where there were other people with children. And my practice now, it's like 18 people. Almost all of them have children, have families, like understand the desire to like have a healthy family life. And I that's wonderful for me. I'm sure it impacted my career decisions some. But I don't know, UCLA was great because it really did feel like a place where a lot of people went to private practice. A lot of people went to fellowship and did very academic things. And you had good training to do that. And you had good examples of people doing like anything that you were interested in doing. There was an example of somebody doing that in the last few years.
Yeah. How about when it came to deciding, you knew you wanted to go into practice, let's say you knew you didn't want to go into a fellowship, but how did you decide what you were looking for in a practice that maybe, would facilitate having more kids down the road? Are there any special considerations you were looking for?
Yeah. I work at Kaiser. I work at the Kaiser in Portland, Oregon. And I think I did look when I was looking at private practices. I looked at Kaiser. I had been interested in Kaiser for a while. I think I really liked what I perceived to be like good support for work-life balance, great benefits, a kind of model where like you get paid for your time more than for your procedures or like what you're selling. I never really felt like I'd be a very good saleswoman. And so I love that like I get paid for my time and my expertise, and that's the way I view it, as opposed to getting paid for like selling things. I do get like encouraged to be quick, and I get rewarded for speed in some ways, but I'm not necessarily paid for speed. And I don't honestly, I think I don't know that I would have. I probably would have done private practice if there was like a perfect job in the right location with the right group. But I was always really interested in Kaiser. And then I loved the people in the group once I came and interviewed, and it seemed like a really good model. And so I've been really glad I'm here.
Yeah, you sound definitely really happy at Kaiser. It's interesting too to think about the dichotomy, and not even a dichotomy because it's between academics, private practice, or, this bigger corporation like Kaiser. And I just think maybe it does come down to the specific private practice, and you have to find, just like when you're applying to residency or a fellowship, and you have to find out what are the people there like, have they had kids before? But I know even in private practice, in the first job that I was at, I took like 1.5 weeks off of paternity leave. And, there's so much pressure for you to be productive that taking potentially 5 months off, that would be crippling to your practice. It would absolutely disable your practice. So you kind of have built-in volume and protection, especially because it's a bigger group, so it's kind of diluted what you have to do. So it's nice that you have that ability to do those things. Now, I know that we've focused a lot on you having kids. I want to talk about in a second Kaiser specifically, because you've mentioned some of the things that you like about Kaiser. We haven't had any guests here. I think everyone we've had on has been in private practice. So I want to talk a little bit more about Kaiser. But the last thing that I want to loop back on, you've made it look almost easy to go through. Really, I wouldn't say ophthalmology is easy, maybe compared to other specialties, but it's not easy. Have 3 kiddos between medical school, residency, and now an attending. Do you have any advice that you would give to younger physicians in training that wanted to have a family, about how to find that balance and, ways to maybe conceptualize how they think about things?
I love it. All of my kids right now are sick also. I got like 6 hours of sleep last night. in like 2-hour chunks. Yeah, they all have fevers.
Oh no.
I'm glad it looks easy. But yeah, I mean, I think my advice is like, if you think you want to do it and don't wait, and like life will be there. And I think you have to focus on, especially in residency, like you want to be fair. You don't want to be a person who's always asking for favors. So, at the very least, trying to make things kind of like fair and equitable for your co-residents is important. But as long as you feel like you're in a situation to do that, have your family when you want to have your family and like figure it out. But I don't think anybody became a bad surgeon from taking, some period of time off for parental leave. You come back, it's still there. There are still many, many cataracts out there in the world that need to be taken out, and other surgeries that need to be done in other specialties. I don't know if that's particularly helpful advice.
I think it is.
No,
I think it is.
helpful.
And I'd love to actually echo that, a little bit of that. Obviously, I haven't had to go through pregnancy itself, but each of us are living our own lives. Our whole identity isn't just being physicians. I think that's a really important thing that we're doing. But we are people. I, have one kiddo, and I'm so grateful for her. The family that I have is such a massive priority for me. And even if you don't have kiddos, if you just have your wife and it's like your personal life, what are your hobbies, things that are important to you? All of medicine doesn't just define you. So don't allow the psychological barrier of like, well, can I still, have a family and live the life that I want to live, and do X or Y and do something within medicine? The truth is you can make it work. And again, I come from a maybe more privileged position in terms of not having to go through physical pregnancy itself. Many examples of people out there making it work in different specialties. So find those mentors that can kind of give you the good advice on what to do. But don't ever feel bad about having your family and, giving priority to them, because, that's a huge part of our lives.
Well, in a field like ophthalmology where your residency class is so small, the absence of one person really can affect the well-being of everyone else. And I by no means am using that as an excuse to not have a family, but that could weigh on someone's mind. Whereas it's so much easier, probably, at least logistically, to have a child if you're a resident, a pediatrics resident or an internal medicine resident, where there's 40 or 50 other people around per class who can cover for your absence. So I imagine that probably weighs on some people's minds when there's only a few other people around. But
that's a great point. I remember, UCLA being so big for an ophthalmology residency, 7 or 8, like that makes a difference. And I do remember, I think it was after I arrived, like Victoria saying she's so direct, being like, okay, it's great. Yeah, you have kids. Like, I have 2 kids. Here's when you should have your kids. You can try to have them at this point and this point. And like, this is how they structure the call. And like, you can figure it out. And like, this person also had kids and this person has kids. And, she was very like, you can do it. We'll help you. We'll figure it out. Don't worry. Like, and I think that's to your point earlier, Andres, that like sometimes people have to volunteer that information. It's not always easy to ask. So that's like a good way to support residents who are up and coming. Tell us about Kaiser. I think a lot of, maybe a lot of our listeners aren't familiar with what a model like that is. And it may not be available to everyone depending on where you are geographically, but I think a lot of people might like to learn what it's like to work in a large integrated healthcare model.
And what you like about it specifically.
There's been a little graph floating around the internet recently due to current events where it's like, which insurer has the most claims rejected by percentages, and which insurer has the fewest claims rejected by percentages. It's actually Kaiser, interestingly. And partly that's because it's this like unique model where we get paid per patient that we take care of, or Kaiser Permanente, the health insurer, gets paid per patient that they take care of. And then everything is included, essentially. So you do a cataract surgery, that's just included in the amount of money you do. You prescribe antibiotics, that's included in the amount of money that is paid per person per year. And then in my Kaiser, and this isn't true at all of them, but in mine in Portland, Oregon, the physician group is separate than the health insurer. So we also get paid like a certain amount from the health insurer per patient that we take care of. But it's a little different than most private practices in the US in that we don't get paid per procedure or per
encounter.
I don't know how people get paid. Or diagnosis, things you do, things you prescribe. And so I think that the focus, I guess one criticism of it is that the focus can be a little bit less interventionist just because you're not making money off of interventions.
Yeah, so avoid risk.
Yeah. But I love it. I love that like I'm sort of paid to take like good evidence-based care of people. And then I'm not challenged much as a physician in terms of what that means. Like I don't fill out prior auths. I don't really have to defend what I think is indicated for a certain patient. You know, if I want like an expensive medication, sometimes I have to say, okay, yeah, we did try all of the, latanoprost first or whatever it is, but I don't spend a lot of time justifying the things that I think patients need, which is really, really nice. I think we probably see a lower volume than most folks in private practice, but some of our systems, like the surgical system and some of the surgical volumes have been like really, really streamlined and I think are really, really efficient, which also gives me great pleasure that I have, like a turnover time of like 10 minutes or what have you. And I can sort of get a lot of procedures done in a day when they're indicated. What else can I tell you about Kaiser? It's a big group. I think I have 18 or 19 ophthalmologists in my group now. And we take care of like thousands and thousands of patients. It's mostly on the West Coast, California, Oregon, Washington. There's Colorado. There's some on the East Coast too. And I don't know, I like it because I also feel like it provides a potential opportunity to solve some of the issues with healthcare cost. It's not like our books don't always balance, I think, depending on the different region and the different specialty, but it's theoretically a little less expensive than the traditional model of like there are health insurance companies and then there are physicians doing procedures and like all of those things are disconnected and the costs just keep going up and up.
It's a broken system for sure in many ways. And I can totally see how for many specialties, and maybe I'm not doing that many prior auths, but some of the issues that you mentioned, what we incentivize within practicing medicine and insurance, the system's just a little bit broken. And I can see how somebody like, family medicine, people that are seeing patients with like 10 chief complaints. And then they're asked at the same time, hey, can you fill out this disability form for me? And also we're going to need you to fill out these many prior auths for these patients that didn't get approved. And you also have to send out this referral for this patient. There's just so much administrative work that can cause a lot of burnout in physicians. So that sounds like a really fantastic paradigm. Certainly nice that you have some security built in. Like I mentioned, it would be incredibly hard for me to take 5 months of private practice off for maternity leave or anybody, because you would just be losing the practice money at that point. And so it's nice to have that feeling like you can live your life, have your family, and still practice medicine the way you'd like to and be passionate about it, not lose too much of the burnout from the administrative backlog that you potentially have.
Actually, to that point, that I do have a question about the way, we don't need specifics, but at Kaiser, are you paid a salary? And, the reason I ask is because I could imagine a mother or a father in private practice, sometimes is disincentivized from taking vacation or taking extended leaves of absences because they don't get paid. So sure, they may be needed at home, but they're not getting paid at the same time. Do you have the opportunity to see a paycheck even if you are gone, or how does it really work?
Yeah, it's a little complex.
I'm sure it's state dependent too.
Yeah, I'm sure it is state dependent. I am salaried. I took off 4 months for maternity leave, and the way that it worked was like I took all of my sick time, and then I took all of my vacation, and then I took all of my education leave, and then I think I got paid through Paid Leave Oregon. So I had like protected
like
time where I was allowed to be off, and I got paid a certain amount. Yeah, similar to disability. And I did get also some disability. So it was totally cobbled together. I didn't get paid my whole salary for the entire period. And at some point I did just stop getting paid, but it wasn't early. Like I got, for getting paid for sick leave and vacation and all those things, I got paid my salary.
Well, I imagine the benefits are probably pretty good, at least, for family and yeah.
Yeah, they're quite good. And there are ways that like you're incentivized if you see X number of extra patients, or, there are some ways that you're sort of rewarded for certain things. You can't take unlimited amounts of time off. You get dinged if you're taking a certain amount of vacation, so on and so forth. But I think relative to a lot of places, it's really quite good and you're quite protected.
Question that I have, and this is a question that we have, and I think I kind of already know what your answer is going to be, but for Gio and I starting out, it's really slow to get busy, and that's part of a known quantity, especially going into private practice where you're just not going to be as busy as you'd like right off the bat. Have to do a lot of marketing yourself. We have other guests that we've chatted about that with. So what was it like starting out the practice for you? How long did it take for you to get busy? What's your kind of scope of practice? I think that this is, I think you've mentioned to me before that something you like about Kaiser is like you can kind of do whatever you want. So what was it like starting out? How long did it take you to get as busy as you want it to be? And what does your practice look like?
Yeah, it was great starting out. I think this was also something I was excited about with Kaiser, is that I wasn't going to have to market myself at all, or be a saleswoman. And when you start, I think they have you seeing like slightly fewer patients than a full schedule. But by the time your schedule is open to be filled, it is filled, and it's awesome. And I was sort of thinking like, oh, like who are these people are just going to let me like walk in and do their cataract surgery? Like, there's no way they're going to all say, no, I won't have you. But no, people were happy to have me take their cataract out. And the wait time was slightly shorter than my colleagues who they would have waited longer for. And it's wonderful. Like, it's just really lovely having people kind of ready to go. And then feeling like you get really experienced really quickly. And so there's this positive feedback loop, I think, with in terms of confidence.
It sounds like you're not just doing cataracts. You are maybe doing a touch of some plastics too. So you have a little bit of variety in terms of what you get to practice, and you have a say in that.
Yeah. Yeah. So I do cataracts and like pterygia in the ORs. I haven't really done a lot of MIGs, but I'd like to do a little bit more of that. I do blephs. I do like lids, lumps and bumps. I do injections, intravitreal injections. I do Botox. I do lasers, like most kinds of lasers.
Yeah, you're pretty supported in kind of doing the things that you like to do within your, like, you can say, I don't want to do this, I want to do that, and find ways to make that.
Within reason. I mean, I think you couldn't say like, oh, I won't do like an urgent retinopexy, because everybody has to share the burden for like call and urgent things. But if I said like, I don't want to do PRP anymore, I think that would be okay. I don't mind though. Put on a little music,
Yeah, I think it's great. You really are a comprehensive ophthalmologist. I think that
I'm pretty comprehensive.
There are a lot of people after training that want to become a comprehensive ophthalmologist, and sometimes find themselves in circumstances where they don't get to see as much stuff as they want to see. So I think that's great. One of the last couple of questions that we usually like to ask our guests at the end is, especially knowing that you're a mom and you've got a couple kids, you seem pretty happy, but would you recommend a career in medicine for your children? And if so, why? If not, why not?
It's a tough one.
We do talk a lot about teeth and like how important teeth are and how much everybody should think about dentistry in this house. I think ophthalmology is a great specialty. Like, I think if my kid expressed interest in medicine, I would say like, that's great. Ophthalmology, dermatology, psychiatry, like think about some of these specialties with limited scope where for whatever reason, there aren't as many like urgent or emergent things where you don't have to stress about people dying as much. I would certainly encourage them if they were interested. I have one kid that like, I think he's built for it. He's just like has the right level of anxiety all the time. And
our people.
Yeah. Yeah, he's our people.
I feel so similarly to for the most part, it's like when asked that question, it's like pause, think about the current landscape of medicine and current landscape of politics and everything. And it's like, I don't know.
Yeah.
Ultimately, I feel like I would want to support whatever she really wants to do, and any future kids, whatever they want to do. But I mean, I certainly would have apprehension if they're like, oh, I want to go be a cardiothoracic surgeon. It's like, wow, that's like really ambitious and impressive. But like,
are you sure?
I feel like you're going to go through so much, and they have to learn some of these lessons on their own. But I mean, yeah, if they want to do a trade, I think trades are really blowing up. There's just so many things that I'd be so much more supportive, be supportive of, not just medicine. So I'm going to let her do whatever she wants to do. But yeah, it's hard knowing and being unable to take this like USB out of your brain and put it in theirs and be like, is this it? Is this the one thing you want to do? But there's certainly a lot of benefits to like, I'm really happy doing what I do. It sounds like you're really happy doing what you do. It's just finding your way there that sometimes can be a little bit tougher.
Yeah.
One final question before we're finished for today. Again, it's been an absolute pleasure having you. You already have a background as a poet. So if you weren't practicing medicine right now, is there anything else that you would like to be doing? Why? And yeah.
I think my alternative what I thought my alternative was to be a teacher. And I think that's a good plan. I don't know what I'd be teaching, like English or literature, high school, get summers off, keep learning every day. I think it requires like a lot of creativity. I think it's a very high energy profession. You have to think on your feet. You have to be really adaptable. You have to kind of tailor what you're saying to each individual person, which is really true of medicine too. That's what I think I'd be doing.
I would be so happy to have myself or anybody that I'm related to or know be your student, because I think you'd be a fantastic teacher. I really, really do.
Well, in a lot of ways, we are teachers, right? As physicians, we're certainly teaching patients every day, and also we're learners as well. So we're learning from our colleagues,
and we have to make things relatable to whatever level of education and whatever person in our chair we encounter. So this is very true. We are in many ways teachers.
Well, this has been great, Claire. We really, really appreciate you spending the time this afternoon to chat with us. Thanks so much.
It's been awesome, guys. Thanks for having me.